A brain abscess is a collection of pus that develops in response to an infection or trauma. It remains a serious and potentially life-threatening condition. Symptoms. The signs and symptoms of a brain abscess are as follows. 1. A headache, 69 to 70% of cases. 2. A fever, 45 to 53%. 3. Seizures, 25 to 35%. 4. Nausea and vomiting, 40%. Changes in mental status occur in 65% of cases, and they may lead to 1. Confusion. 2. Drowsiness and lethargy. 3. Irritability. 4. Poor mental focus. 5. Poor responsiveness. Causes. A brain abscess is most likely to result from a bacterial or fungal infection in some part of the brain. Parasites can also cause an abscess. When the bacteria, fungi, or parasites infect part of the brain, swelling occurs. In these cases, the abscess will consist of infected brain cells, active and dead white blood cells, and the organisms that cause the problem. As the cells accumulate, a wall or membrane develops around the abscess. This helps to isolate the infection and keep it from spreading to healthy tissue. How infection enters the brain. Brain infections are fairly uncommon for several reasons. One reason involves the blood-brain barrier, a protective network of blood vessels and cells. It blocks certain components from the blood that flows to the brain, but it allows others to pass through. Sometimes, an infection can get through the blood-brain barrier. This can happen when inflammation damages the barrier, leading to gaps. Treatment. Treatment will generally involve surgery and medication. If tests show that an infection is viral rather than bacterial, the doctor will alter the treatment accordingly. The effectiveness of the treatment will depend on 1. The size of the abscess. 2. How many abscesses there are. 3. The cause of the abscess. 4. The general state of the person's health. If the abscess is smaller than 1 inch across, the person will probably only receive intravenous antibiotic, antifungal, or antiviral medication. However, a doctor may need to drain a smaller abscess to determine which antibiotics will be best. If an abscess is bigger than 1 inch across, a doctor will need to aspirate it, drain it, or cut it out. Surgery. A person may need surgery if 1. Pressure in the brain continues to build. 2. The abscess does not respond to medication. 3. There is gas in the abscess. Medication. A short course of high-dosage corticosteroids may help if there is increased intracranial pressure and a risk of complications, such as meningitis. If you are new at our channel, please subscribe our channel. It will be great support for us.